Hi, I'm Kevin Harrington, an original shark from the hit TV show Shark Tank. And with me is Dr. Mariaclara Bago, as well as Dr. Vincent Apichella. Thanks, guys, for being here.
Thank you so much.
Hey,
It's our
welcome.
pleasure. Yes.
And so now your company is called Premier Wellness, and you have a real desire to help executives. You have an executive physical that you perform. Now, I know executives are CEOs, but this applies for more than just CEOs, correct?
Right.
Yeah? Explain.
You can be the CEO of a corporation or the CEO of your own household.
Of your family.
We're all affected by the same stressors and the same environmental factors that start to deteriorate our health.
Right. Now, for 15 years, you've operated this practice. You're also board certified physicians that have a specialty in family medicine, correct?
Yes.
So that's pretty cool. You're very powerful. Now you're able to take that experience, because you've seen some shifts in medicine. You don't think that medicine was delivering, the medical industry was delivering everything needed for some of these people performing at high levels, correct?
No, I mean, we're both family trained or board certified in family practice,
Right.
traditional medicine as we know it. And the way we were trained was always to see a symptom and give a pill. And within our first 2 years of practicing, we were just noticing a trend. Patients come in, there's a symptom, here's a pill. Okay, they come back, we look at their blood work, they
may need more pills.
They
right?
need more pills.
Right.
And by the time, there was a point in our career where I'd have a patient I'd seen for 2 to 3 years. They came to me with no meds. They were on 5 or 6. Their labs look great, right? Oh, look, numbers look good. But the patient had gained weight, felt horrible, was fatigued, couldn't sleep at night. There were so many other problems. So it was at that point that we decided to get our fellowship in anti-aging and functional medicine.
Ah, there you go.
And so there we learned root cause medicine. So why was the patient gaining weight? What was going on? What were the symptoms? How we could kind of work with a different set of tools. So I just hated not only always having just the pill. So we incorporated other things like lifestyle medicine. We did nutrition, detox, IV therapy, hormone replacement therapy. We do platelet-rich plasma. We do detoxification.
You're problem solvers in many areas
Yes,
across
yes.
the board, right?
Chelation therapy.
You know, and it's no mystery that we are the sickest nation in the world.
Right.
And we're faced with a chronic disease epidemic in our culture right now. Heart disease and cancer are the 2 greatest killers of Americans, and those numbers are going up, not down.
Right.
Having insurance isn't always the answer. We know that 90% of Americans have health insurance, but yet we're still seeing all these chronic diseases going up.
Gotcha.
Tremendous spike in Alzheimer's, dementia. You know, these are major things that are causing a decrease in quality of our lives, and that's sort of where the executive platform was born.
Love it.
It was there to help people go outside the boundaries of the conventional medicine model that they know of and take more accountability and control of their health.
Right. So the executive platform it's for CEOs of corporations, but it's for moms that are CEOs of the family
Yes.
too, right? That moms are operating at a high level, running the family business. It's also athletes and pretty much across the board. You offer this package.
Well, we're facing and again, what we're seeing while we're seeing patients is we are spread so thin. I mean, I myself, I'm a business owner. I'm a physician. We're both parents to 4 children.
Yeah.
And at the end of the day, our health, which is our greatest wealth, is usually the last thing. Okay, yeah, I'll get to it. And I work with a lot of women who, at the end of the day, come to see me and they've been diagnosed with cancer. They've been diagnosed with an autoimmune process. Well, years of stress and just burning the candles at both ends has led this to it. And so the idea of this platform is you can get a year's worth of healthcare in one day.
Wow.
So you're really taking that element of time, which we're all so pulled in different ways, and you can get it literally.
So let's just walk through. Someone comes in, and one day they're going to get all these different kinds of analysis, right? What things are you looking at?
It starts with an intense blood work analysis of things that are not included in your traditional medical model.
Yes,
Full
okay.
hormone panel, we do full thyroid panel, we do a nutritional evaluation, we do cancer,
When I see
inflammation.
blood, they check off some boxes, but you're checking off a lot of boxes for all the things you're doing.
We look at different metabolic hormonal markers, those messengers that are sending things back and forth to the brain.
Right.
We're looking at key indicators that can help us we can use those as a medical crystal ball, and we can use them as a tool to help predict your future health.
Yeah.
Another one of the most important things we do is body composition analysis.
Okay.
And many people don't understand that the visceral adipose tissue that they have inside is a tremendous source of toxins and harmful hormones, and it can be a huge indicator of predicting chronic disease down the road.
Wow.
Yeah.
I got to check mine on. You got me all thinking
You'll
about
probably
it
be
now.
okay, but we should still look.
Okay.
We look
So-
at your essential fatty acids.
You do
we
all
look
kinds of-
at your resting metabolic rate so that we can create a unique plan specifically for you.
One last thing. You got to have, is there anybody that comes off the top of your head that you can think of that's had some kind of a real amazing transformation by coming through your program?
Every patient is a success story.
Fantastic.
And I say that because we've been able to find things that are just subtle clues that people can create change that are going to add years to their life and give them more functional longevity.
Right.
But one A-lister in our community is a 50-year-old guy, great health, peak performance, peak shape. We found a major heart disease issue in this guy that we were
This
able
came
to
through the executive program.
to
right?
start
High
treatment
functioning,
early enough.
very well, no
symptoms or
symptoms,
anything. You know, another gentleman is a 39-year-old executive entrepreneur, type A, go kind of guy, mainly concerned about weight problems, but essentially he was walking around with diabetes and mild cognitive impairment already at the
Wow.
age of 39. So
Yeah.
90 days into the program, he's down 4 inches on his waistline and performing
Right.
better than ever.
So you need to get this check. It's something, anybody out there that has not had this kind of deep dive executive program, this is going to be just across the board. I don't know, maybe just if you could summarize all the different things that you do in this executive kind of program that you, for a CEO or a mom or an athlete.
Yeah, comprehensive health risk appraisal, history taking, metabolic, neurologic assessment, laboratory diagnostics, and then we put it all together to create your crystal ball of a treatment matrix.
Wow.
And it's just imagining the possibilities of predicting your future health.
Like one of the things I
Treatment
want to make
matrix, I
for
like that.
as a differentiator is a lot of executive exams out there. Look, we're going to go ahead and get a whole series of imaging studies. Oh, look, you know, there's a cancer. The difference we have in our approach is we look at that, but it's not that while we are there to diagnose, we're also there to prevent. So we can say, you know what, I know these look good, but there's so many red flags because of this marker, and this marker. You will, or potentially within the next 2 to 3 years, can develop a cancer, can develop a diabetes. We are able to see the red flags beforehand and kind of give them that treatment plan, that matrix
Right.
we talk about, so that they can, for the next year, kind of work on preventing.
And so now is the time to do this really for anyone, because if it's going to increase your performance and your good feeling about your overall health, it's an important thing to be doing.
It's always
right
easier to do now
right?
before
Okay,
after
well,
the fact,
fantastic.
so.
So Premier Wellness, the numbers and way to get a hold of our doctors here, Dr. Mariaclara Bago and Dr. Vincent Apichella. I want to thank them for being with us here
Thank you
today.
so much.
And
Thank you.
recommend that anyone out there, you're in the West Palm area, but you cover lots of South Florida, check it out, get a hold of them through the website and the information below. Thank you.